Hi, coders. This is Miss Marie. How is everybody tonight? Hi, Simon. Hi, Miss Patricia. I am in the cold but beautiful upstate Michigan. It is so stinking cold here today that they had to cancel school because by state law, if it's 20 below or colder, you can't send kids to school here. Hey, Francine. Hi, Deborah. Um, it's a little, yeah, it's pretty clear. I'm surrounded by Amish people where I live, so there's not a whole lot of pollution. But my goodness, it was chilly. Did you guys all have a good weekend? Yeah, Burr is putting it mildly. Hey, Cheryl. Um, we have a great team tonight, and I want to bring them in and let them say hello to you. Miss Josie from beautiful California. Would you like to say hi to the coders?
Hi, coders. Happy Monday. Happy Martin Luther King Day. I hope everyone got some rest, some much needed rest, and we're going to have a great study tonight. Mrs. Marie has put together some really good scenarios, and I'm excited to get started. How about you?
Thanks, Miss Josie. They look like they're raring to go. Okay, in addition to Miss Josie, we have AMC's very own rock star, Miss Melissa is here with us tonight. Miss Melissa, would you like to say hi to the coders?
Hi, coders, rock star. I can't believe that. I feel like I should come in with some
Air guitar.
music, like yeah. Hi, coders. I'm so glad to be here with you today, and I'm so glad that you guys have shown up for our group study tonight, and I think it's going to be fabulous. So, how about it? Let's get started.
See, Francine and Patricia agree with me. You're a rock star. All right. We have a bunch of stuff to get through tonight. This is our very first group study dedicated purely to the 60,000 series. So let's start rolling, okay? As always, we have some business and legalities to cover. CPT is a copyright 2019 of the American Medical Association. All rights are reserved. Fee schedules, relative value units, conversion factors, and/or related components are not assigned by the AMA, are not part of CPT, and the AMA is not recommending their use. The AMA does not directly or indirectly practice medicine or dispense medical services. The AMA assumes no liability for data contained or not contained herein. CPC is a registered trademark of the AAPC. AAPC content found within this presentation is copyright of AAPC. Keyword concept, FTR, CHUN, AMCI Fab 7, and Flip and Tap are trademarks of AMCI. Okay, I think, unless anybody has a question, I think we're ready to start on the time scenarios. The chat looks pretty quiet to me, so I'm going to guess everybody's set. Miss Melissa, could you read this scenario for me, please?
I'd be happy to. All right, coders, here are your answers. As you know, we like to give you the answers first. A is frontal, parietal, temporal, occipital. B is sulci, cerebellum, pons, medulla. C is frontal, cerebral, cerebellum, pons. And D is frontal, cerebrum, temporal, occipital. What are the four lobes of the brain? And I'm going to give you 1.5 minutes, I think is what Miss Marie said. So your time starts now. All right, that's time. And from the answers in the chat, I see that you guys know your stuff.
They certainly do. They're doing a great job. Okay, coders. The four lobes of the brain are the frontal, parietal, temporal, and occipital. I just want to remind you that you have this lovely drawing in your book. It's on page 411, and it labels the parts of the brain. Frontal, which is, as the name implies, at the front, the parietal, the temporal, which is just above your ears, and the occipital, which is on, it's basically sort of right at that curve on the back of your scalp. The last part is the cerebellum that's just below that. Okay, Miss Josie, would you mind reading the scenario, please?
Sure, I can do that. Okay, the question is, what ICD-10 code, CM code, is used for a non-intractable grand mal seizure with status epilepticus? And you want to do 2 minutes? I guess we'll do 2 minutes. Mrs. Marie?
Yes, please.
2 minutes, coders. You may begin now. Okay, coders, how's everybody doing? Do we need more time?
I'm just watching the chat. They're doing pretty well, but not quite. Okay, coders. Chat has slowed down, so I'm going to move forward. The answer to this question is G40.401. As we go into solve this, in the chat, tell me what the main term you're looking up in the alphabetic index is. That's our first step. Right, Patricia. Good job, Katwana. Good job, Cheryl, Elaine, Tina, Angela. Okay, because our main term, or our keywords here are non-intractable, grand mal, seizure with status epilepticus. And our first step is to look up the main term in the alpha index, and our main term here is seizure. So when we look at that, then we go down, use these shaded lines here to help track. We find grand mal, which says it's G40.90909, but we want a not intractable. And again, it says G40.409, but we also have status epilepticus, which sends us to G40.401. Okay, is that good enough, or do we need to take another step, coders? We need, oops, sorry. So we go seizure, then grand mal, non-intractable, then finally with status epilepticus. And again, our answer is G40.401, and then yes, Linda, Angela, we then need to verify it in the tabular list. Okay, so we go to that page, and we see G40.4, and we notice that grand mal seizure is included in that coding group. So then we go farther down the path, we see not intractable, G40.40, and we know that we need a sixth character. So we look down, and at G40.401, we have other generalized epilepsy and epileptic syndromes not intractable with status epilepticus. Does that make sense to everybody? If you're all set and ready to move on, say got it for me in the chat, please. Got it? Okay, good, 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 good. All right, moving on. Oop. Okay. Miss Melissa, would you mind reading this one for me, please?
Sure thing. All right, coders, your answers are R20.2, G81.92, G82.21, and G83.32. What ICD-10-CM code is used for hemiplegia affecting the left dominant side? I've got 2 minutes on my watch, and I'm going to start it now. All right, coders, that's time.
Wow. They're doing really well. The answers are flying in the chat. Going to give you a couple more seconds. Okay. Okay, coders, the answer is B, G81.92, and most of you got that right off the bat. And a remarkable number of you did it very quickly. We're going to walk through the steps, though. Okay, our main term, we're going to go to this R20 code first and look it up because it's sort of the odd duck in this group. Our keywords are hemiplegia, affecting left dominant side. The R20 code, that's disturbances of skin sensation. Is that what hemiplegia means, coders? No, that's not what hemiplegia means. And R20.2 is paresthesia of skin. That's certainly not right, so we're going to eliminate answer A. Okay. Then we have paraplegia, G82.2. Paraplegia is different from hemiplegia, isn't it? Does anybody know what the difference is? Yes, hemi is half. G82.21 is paraplegia complete. That is, does that match our keywords? It does not. So we're going to eliminate G82.21. Next, let's look at G83.32. That's monoplegia. What do you think monoplegia means? Or monoplegia. What's mono mean? Single. Correct. And it doesn't mean, hemi means half. Mono means single or one. So we know that we're not in the right place. Although G83.32 is monoplegia, unspecified, affecting the left dominant side. However, it's the wrong root word. It's the wrong condition. So we're eliminating D. Just to be sure, we're going to check B. G81.9 is for hemiplegia, and it tells us we need a fifth character. We look at G81.92. That's hemiplegia affecting, unspecified, affecting the left dominant side. That matches every one of our keywords. It matches the laterality. And that means we have a winner. The answer is B, G81.92. Did everybody follow that? I think so, because most of you got that right off the bat. Let me know in the chat if you have questions or if you got it. Got it. Okay, great. Moving on. Whoa, just a second, coders. I'm not sure what happened just there. Miss Josie, would you mind reading this scenario for me, please?
Sure, if I can see it. I can't see the. There it goes. Okay. Okay, we're going to start with the answers first. And A is 64831 and 64872. B, 64834 and 64837 with the modifier 51. C, 64831 and 64837 modifier 51. D, 64831 and 64832. The question is, a 15-year-old has been taken to surgery for crushing his index and middle fingers and injuring his digital nerves. The provider located the damaged nerves in both fingers and sutures them to restore sensory function. What CPT codes are reported? And we'll start with 2 minutes and see how everyone does there. You may begin now. I think we need a few more minutes, Miss Marie. We'll give them about 10 more seconds.
I'll just keep an eye in the chat. Thanks, Miss Josie. Okay, I think the chat has really slowed down now. I just want to remind you, when you respond to these scenarios, give us your answer, but also give us your keywords. The answer on this scenario, and a lot of you got it, is answer D, 64831, 64832. Our keywords are 15-year-old, crushing his index and middle fingers, injuring his digital nerves, located the damaged located the damaged nerves in both fingers and sutures them to restore sensory function. Okay, I have the codes up on the right side of the screen. Do you guys notice anything before I even start to solve this? Do you notice anything about any of these answers that would eliminate them right off the bat? Sorry. Right, Tina, Tiffany, Cheryl, Haji, am I saying that correctly? Yes, B and C, 64837, it's an add-on code. and that means that you cannot use modifier 51 on it. So right now, you could eliminate B and C, okay? So you'd only be looking at A and D. That's one way to have quickly eliminated 2 of the 4 answers. I'm going to go through a more proper sequencing though. Since 3 out of the 4 codes start with 64381, I'm going to look at 64384 first, because it's kind of the odd man out, so it's either going to be very right or very wrong. So 64834, suture of one nerve, hand or foot, common sensory nerve. Common sensory nerve. Do we see that in the scenario? No. We have digital nerves in the scenario. So what does that mean? That's a second reason to eliminate B. Okay? So it's doubly wrong. So let's move on. The rest of them all start with 64831. And we'll start at the top line, 64872, which is suture of nerve requiring secondary or delayed suture. Do you see secondary or delayed as a keyword in the scenario? No. So that's one reason to get rid of that little rascule. But an even better reason is, oh, my click didn't show up. So let me grab a laser pointer. What does this parenthetical note say? It tells us that we can use it in conjunction with 64831 through 64865. So we're going to go to look at 64831 next. That says suture of digital nerve, hand or foot, one nerve. Well, digital nerve matches what we have, our scenario. It matches our keyword, one of our keywords. But this is only coding for one nerve. So we need to look at the second code, 64832 and 64837. We'll go to 64837 first. That is suture of each additional nerve, hand or foot. And we check our parenthetical notes, as always. And that tells us to use 64837 in conjunction with 64834 or 64836. That means that we're in the wrong place. We would have known that had our pages been shunned, because we would have circled these groups and we would have realized that we were in the wrong code family. So that's a third reason. Sorry, that's a third thing that can help us quickly. Does everybody follow me on that one? So let's just verify. Oh, this isn't moving forward for me now. There it goes. We're going to get rid of C, but we're going to verify the codes on D. It tells us to use 64832 in conjunction with 64831. So that means 64832 is a good code. It's for each additional nerve. We have 2 nerves that we're dealing with here. One on the index, one on the middle. So we can verify that D is the correct code. Does anybody have questions on this? Does it make sense to everybody? Let me know. Okay, everybody's ready to move on? Oh, somebody's growling because their new book isn't chunned yet. I just want you guys to all know that the new chun party will start on Wednesday morning. If anybody wants to join the chun face book group, the chun party starts on Wednesday. Okay? I understand that people are using the old books right now, but I want to warn you, there's a lot of changes, particularly in integumentary, a few in musculoskeletal, but there's a fair number sprinkled throughout the book. They kind of relate back to some of the changes that happened in the integumentary system for 2019. Okay, I'm going to move on. And I would like Miss Melissa to read this for me, if you would, please.
All right, here are your answers. We've got A, 61000. B is 61001, modifier 63. C is 61000, modifier 50. D is 61020 with modifier 63 and 61000 with modifier 50. A 6-month-old patient required a bilateral subdural tap through a suture. How would this initial procedure be reported? And coders, I've got 2.5 minutes set, and you may start now. All right, coders, that's time.
Thanks, Miss Melissa. Looks like the chat has slowed down. Okay, coders. The answer to this question is A, 61000. Let's walk through this and see how to find the right one, okay? Keywords: 6-month-old patient, bilateral subdural tap through a suture, initial procedure. That's what we care about, okay? 61020 is the odd man out of these codes, so we're going to check it. It says ventricular puncture through a previous burr hole. Do we see anything in this scenario about ventricular punctures or a previous burr hole? No, we do not. And in fact, we eliminate it. Okay, 61000 is the parent code for the 3 remaining solutions. That's subdural tap through the fontanelle or suture, infant. That matches our keywords pretty well, doesn't it? Right, it has the keywords. It has initial. So when we look at 61001, number 1, we see that that's for a subsequent tap, and we already know that this is an initial procedure. Number 2, what else eliminates this? Modifier 63. Is there anything here that indicates that this infant is less than 4 kilograms? No, 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 no. So that is doubly wrong. Wrong procedure, wrong modifier. B is eliminated. That leaves us with 61000 and 61000 with the 50 modifier. Okay, let's look at the rest of this code language on 61000. And let's see. It says unilateral or bilateral. And modifier 50 is for bilateral procedures. Do we need to use a modifier 50 if bilateral is in the code language? No. So once again, the modifiers could help us eliminate an answer, and we eliminate C. That means that 61000 is our star, and it's our answer. Does everybody follow me on that? Does anybody have any questions? If you do, put it in the chat, please. If you don't, let me know that you got it. Okay. If you have the word bilateral indicated in your chun, then you don't have to clog up your book with the information that no 50 modifier. Because the fine line in chunning is to make sure you have the information you need, but not so much information that you lose time during the exam reading a bunch of extraneous information. Okay? Okay, it looks like everybody has it, so I'm going to move on. Okay. Miss Josie, would you read this for me, please?
Sure. We're going to start with the answers first. A is 50545 and D35.01. B 60650 and D35.01. C 60540 and C 47.9. D 60545 and C 47.9. A patient with a right side benign adrenal adenoma has a laparoscopic adrenalectomy. What CPT and ICD-CM codes are reported? And we're going to do 2 minutes on this one. You may begin now. Okay, coders, 2 minutes is up. Thank you.
We still have answers coming in, so I'm going to wait for just another minute. You guys are doing great. Okay, it's slowed down in the chat, so I'm going to move forward. The answer to this scenario is B, 60650 D35.01. Okay, let's see how I got there. Keywords are right side, benign adrenal adenoma, laparoscopic adrenalectomy. Okay, we're going to look, since the 505 code is sort of out there on its own, we're going to look at that first. 50545 is a radical nephrectomy. Well, I don't see those keywords. I don't see that in our scenario at all. This doesn't say anything about a nephrectomy. Doesn't have anything to do with the kidneys. So I'm going to eliminate A. That leaves us with a bunch of 60,000 series codes to look at. So let's pull those up. Okay, 60540, adrenalectomy, partial or complete, or exploration of adrenal gland with or without biopsy, transabdominal, lumbar, or dorsal. Adrenalectomy works. Did any of the rest of that code language happen? I don't see those in the keywords. Also, what's the approach on 60540? We know that we're looking for a laparoscopic approach. Isn't this in the excision area, meaning it's an open procedure? Yes, it says transabdominal. That means it's open. So that means that it's wrong. All right, 60545. That's a indented code of the same family. So that means it's also open, also the wrong approach. Because we are, again, we're looking for a laparoscopic procedure. So we can eliminate 60540 because it's the wrong approach. And we can eliminate 60545 because it's not just only the wrong approach, but it's also the wrong procedure. Because there's nothing here about excision of adjacent retroperitoneal tumor. Somebody's asking if we can rule out C and D right away because of the ICD-10-CM code. Right now, we're looking at CPT coding. And in CPT coding, we're proving our mastery of the CPT manual. So our first most important thing to process is whether or not it's the legitimate and correct CPT code. We always look at the procedure codes first, and then if we have a tie, or even, we always pick the right CPT code first, and then we verify the diagnosis. Okay, so 60650, I look at right there. 60650 is laparoscopy, surgical with adrenalectomy, partial or complete, or exploration of adrenal gland with or without biopsy, transabdominal, lumbar, or dorsal. That sounds pretty good to me. We have the laparoscopy, we have the adrenalectomy. So I'm going to say it's looking like a pretty good code, but let's verify the diagnosis. All right. As always, we would go. I know this says benign adrenal adenoma, so some people may have gone straight to the neoplasm table, but just to be safe, I went to adenoma because that's my main term. And right here it says, see also neoplasm benign by site. But I looked up adenoma and then adrenal, which sent me to the D35.00 family. I went to the tabular list. And D35, it tells me I need a fourth digit. But it's for benign neoplasm of other and unspecified endocrine glands. And what's your adrenal gland? It's part of the endocrine system, so we're in the right spot. We look at D35.0. We have benign neoplasm of the adrenal gland, which is good. It tells us that it's the right side, so we want D35. Sorry, I'm behind myself on my clicks. D35.01. So we have verified the diagnosis, and this is absolutely correctly coded. Does anybody have any questions? Carla, I would hesitate on an outpatient coding exam, particularly the CPC. I would never immediately eliminate an answer based on the ICD-10 CM code. I would first investigate all of the CPT codes because they're testing you on your mastery of CPT coding. All right. Does that make sense, or should I try to explain that another way? It's very quiet in the chat. Should I move on, or does anybody else have a question? I'll give you 5 seconds to type something. Good to go? Okay. No. Once again, if you're sitting for the CPC exam, even in the CCS, when you sit for it, they're testing how good you are at CPT coding. So your priority is always the CPT codes. The ICD-10 codes, when they're combined with the CPT code, they are an afterthought. They are your last line of defense. You always check the CPT codes first. I can't stress that enough. Okay, moving on. Miss Melissa, would you read this for me, please?
Sure enough. All right, coders, here are our answers. A is 64493 with modifier 50 and modifier 26. B is 64493 and 77003 with modifier 26. C is 64493, modifier 50 and 77003. And then D is 64493. Here's your scenario. Our operative report, the procedure is a left L3 to L4 periarticular paravertebral facet joint injection. Patient history. The patient is a 67-year-old woman referred by Dr. X for repeat diagnostic therapeutic spinal injection procedure. She is about 1.5 years status post-lumbar decompression for stenosis. 2 weeks ago, she underwent an interarticular left L4 to L5 paravertebral facet joint injection. She had no relief of symptoms from that injection. Technique. The patient was positioned prone and the skin was prepped and draped in the usual sterile fashion. The skin and underlying soft tissues were anesthetized with 3 cc's of 1% lidocaine due to the advanced degenerative changes. The left L3 to L4 paravertebral facet joint could not be distinctly visualized fluoroscopically. despite trying numerous angles. This was explained to the patient who wished to proceed with the injection. A 22-gauge, 6-inch spinal needle was advanced toward the region of the left L3 to L4 paravertebral facet joint under fluoroscopic guidance. Injection of 0.5 cc's of IsoView 200 contrast showed the needle was not in an intravascular location. Intra-articular placement could not be confirmed, and the injection was presumed to be periarticular. 2 cc's containing equal parts preservative-free 2% lidocaine plus depomedrol 80 milligrams per milliliter was injected. The patient reported injection of medication produced discomfort in the region of her usual left low back pain. Immediately following the procedure, upon standing up from the procedure table, she reported her pain was a little bit better. What CPT code or codes is or are reported for this procedure? Encoders, you've got 2.5 minutes starting now. All right, that is time. Miss Marie, do you want me to give them a little bit more time?
I think we're doing pretty well. It was raining in the chat for a minute or so there. I'll just watch for a second. Thanks, Miss Melissa.
No problem.
Okay, I think we're in pretty good shape. Coders, most of you got this correct, but officially, just so you know, doesn't want to take my clicks, but the answer is D. Let's look at this in a little bit more detail. Exactly, Tia. Okay, keywords: left, L3, L4, periarticular paravertebral facet joint injection, 67-year-old woman, repeat diagnostic / therapeutic spinal injection procedure, positioned prone. Can you tell me in the chat what direction she's facing if she's positioned prone? Right, she's facing down. Okay, continuing on the keywords, left L3, L4 paravertebral facet joint, could not be distinctly visualized fluoroscopically, 22 gauge 6-inch spinal needle advanced, left L3, L4 paravertebral facet joint under fluoroscopic guidance. Okay, basically this shoots down to 64493 and 77003. Okay, coders, answer me this. How many times did you see the word left in this scenario? Here's 1, 2, 3, 4, I see it. Oh, wait a minute. 5. Yeah, that's a lot of lefts. Sometimes on these longer scenarios, when you see a word repeatedly, that's a pretty good clue. So since we see a lot of lefts and I don't see any rights, does that mean this could possibly be bilateral? No. So you can pretty much kick A and C to the curb right now before I even, but I'm going to keep talking anyhow because that's how I roll. All right. I just wanted to point that out. All right, 64493. It's injection, diagnostic, or therapeutic agent, which is what we have right here, diagnostic therapeutic injection. We have paravertebral facet joint, which is also in our keywords. Lumbar sacral single level. There we have several times. We have it. Sorry, my little square is a little bit off, but we know that they just injected L3, L4. As we've discussed, they're only talking about her left side, so we can get rid of A and C. Okay, continuing on to the code descriptor for 64493, it says with image guidance fluoroscopy, or CT. If it's included in the code language, do we code that separately? No, we don't. So at this point, we're good coders and we're very thorough, so we're going to look at 77003, and that's for fluoroscopic guidance. So but we're not going to code it because it's included in the code description for 64493. That makes D our answer. And you guys did really well on that. Does anybody have any questions? Or did that all make sense? Got it? Okay. Good, good, good. Good, good, good. Let me get rid of all my little scribbles all over here so it doesn't stay on the screen. I'm a sloppy scribbler, guys, sorry. And Let's move on. Ms. Josie, would you mind reading this for me, please?
Sure, I can do that. Okay, coders. A is 64802, I73.00. B is 64802, modifier 50, I73.00. C is 64804, I73.01. And D, 64804, modifier 50, I73.01. A provider is performing an experimental cervical sympathectomy on a patient with Raynaud's syndrome. What CPT and ICD-10 codes are reported? We're going to do the 2 minutes, and you may begin now. Okay, coders, if you want to change your answers, go ahead. But I think everybody's pretty much in there. Thank you.
Okay, coders, you did really well on this. It looks like the chat's slowing down. So, answer is A, 64802, I73.00. Let's go verify that and see how we got there. Keyword, provider, cervical sympathectomy, Raynaud's syndrome. We only have two CPT codes to look at, 64802 and 64804. We're going to look at 64804 first because it's sort of the odd man out. That's a sympathectomy, cervicothoracic. Does that match our keywords, coders? No. Correct. It does not. So we can eliminate answer D. So now we're looking at variations of 64802. Let's check the code just to be sure. It's a sympathectomy cervical, which matches our keyword cervical sympathectomy. So that means we like 64802 a lot. What does it tell us? For bilateral procedure, report 64802 with modifier 50. Do we have any language that makes us think that this is bilateral coders? No. So we probably don't need answer B, right? Oh, I have a feeling my clicks are messed up on this one. We're going to look at the diagnostic coding. We looked up Raynaud's. It sent us to I7 3.0. We double check. I7 3.0.0 is without gangrene. We have no mention of gangrene in our scenario. So we can eliminate answer C. Coders, this is wrong. The answer is A. And I'm sorry, my PowerPoint blew up right before class and I did not get this slide fixed. There's nothing here about 50. So this red line right here should be through B. And the answer is A. I apologize for the confusion. The answer is A. I didn't get back in here to fix this when everything else went kablooey on me. Okay. So I'm going to move on to the next one since that's messed up. Let me know if you need me to go over that next week with the correct slides or if you're all okay. Not next week, it would be 4 weeks from now, the next rotation. And again, I apologize. I agree. I agree. That whole bilateral thing, your eye just gets drawn to it. Okay, if everybody's set, I'm going to move on to the next scenario. Miss Melissa, would you mind reading this for me, please?
Yes, ma'am. All right, we've got A is 63050 and M 50.21. B is 63020 and M 50.21. C is 63020 and 63035 with M 50.91. And D is 63050 with M 50.91. A patient with a herniated cervical disc undergoes a cervical laminotomy with a partial fascectomy and excision of the herniated disc for cervical interspace C3 to C4. What CPT and ICD-10-CM codes are reported? And coders, I've got 2.5 minutes set for you, starting now. All right, coders, that's time.
Okay.
Did we lose? Oh, there.
No, sorry. I was just watching the chat. Okay, coders. Looks like the chat has slowed down, so I'm going to go ahead and reveal the answer, which is answer B, 63020 M50.21. Okay, the keywords on this scenario: herniated cervical disc, cervical laminotomy, partial facetectomy, excision of the herniated disc, cervical interspace C3, C4. So, we've really only got two procedure codes to look at here, 63020 and 63050. So, we'll look at 63050 first. That says laminoplasty. Do we have anything about a laminoplasty documented in this scenario? No. Au contraire, Pierre, we do not. We have a laminotomy. That's a whole different deal. Wrong procedure. So we're knocking it out. We have an astute coder pointing out that 63050 is also for 2 or more vertebral segments, and we only have one documented. Good point, Deborah. Okay, so we're going to go with 63020, which is a laminotomy, just like we have in our scenario. It includes a partial facetectomy, which is what we have here. And it includes excision of herniated intervertebral disc, which we also have right here. It's for one interspace. That all looks very good, right? So if we're deciding between B and we better just take a peek at 63035, just to be sure. That is an add-on code for each additional interspace. We don't have any additional interspace, so we can eliminate C. Is that clear to everybody? I think you all got it right. Oh, you can't see the screen? All right, let me go back. I'll do this again so you can see what I'm doing.
Miss Marie, are you still there?
I'm having a terrible night, coders. I'm so sorry. You've at least seen the whole the whole clicks this time since you missed it that time. Can you hear me now?
I can hear you, but you're still stuck on a patient with a herniated cervical disc, the original slide.
Well, I got to tell you, this is harsh in my mellow. All right. There. I see it moving. Does everybody else see it moving?
Yes.
All right. Okay, here we go. Laminoplasty. Not the right procedure code, getting rid of A and D. Laminotomy matches our keywords. Partial facetectomy, which matches our keywords. Excision of herniated intervertebral disc, once again, matching our keywords. We're at one interspace cervical, which is exactly what we have in the scenario. So I'm thinking 63020 is a good code. 63035 is for each additional interspace. We do not have that. So we can eliminate C. We'll double check the diagnosis because we're being thorough. M50.2 is other cervical disc displacement. M50.21 is for the high cervical region. And the notes down here tell us that that includes C2, C3, and C3, C4. So we verified both codes, and the answer is B. Now that we've seen those pictures put together, is that everybody got that? Thanks for letting me know that everything was stuck. Okay. I think we're in pretty good shape. Let's move on. Okay. And I believe that this is Miss Josie's turn. I'd like you to read it for me if you would, please.
Sure. Be happy to, Miss Marie. Okay, coders. Here we're going to start with the answers first. A is 62350, C 70.0, B 62362, C 70.1, C is 62360, C 70.0, D is 62367, C 70.1. And a patient who has a malignant neoplasm of the spinal meninges is receiving a programmable pump implantation for chemotherapy. The patient is placed in the prone position where the provider made a midline incision overlying the area of the spinal cord. The reservoir was placed in the subcutaneous tissues and attached to the previously placed catheter. Layered sutures were used to close the incision. The patient tolerated the procedure well and was released in good condition. What CPT and ICD-10 CM codes are reported for this procedure? And you may begin now. Thank you. Okay, coders, get your answers in. Thank you.
Okay, it looks like the chat's slowing down. The solution for this one is answer B, 62362, C70.1. Our keywords: malignant neoplasm, spinal meninges, receiving programmable pump implantation for chemotherapy, prone position, midline incision, reservoir was placed, attached to the previously placed catheter. Okay? So we have all codes in the same group. The first set of codes, the 62350, is for catheter implantation. That's for implantation, revision, or repositioning of tunneled intrathecal or epidural catheter. Are they replacing the catheter here, coders? I think that we see that they're replacing the programmable pump. So we're eliminating answer A. Okay? Looks like we're moving down to reservoir pump implantation, which looks better. 62360. Implantation or replacement of device for intrathecal or epidural drug infusion. Subcutaneous reservoir. We're looking for a programmable pump for chemotherapy. So I'm going to eliminate 62360. Now we're looking at 62362 and 62367. 62367 is electronic analysis of programmable implanted pump. Does it say anything about that in this scenario? Does that match any of your keywords? No. So we're going to boot 62367. We're going to verify our diagnoses. Both of them say C70.1. Or sorry, both of them say C70.1, and if we look it up in the tabular list, C70.1 is a malignant neoplasm of the spinal meninges. Once again, we've matched our code words. We don't have anything about electronic analysis, so we're eliminating answer D. We look at 62362, we see programmable pump, including preparation of pump, with or without programming. That matches our scenario. So B is our answer. Does that make sense to everybody? You can eliminate your keywords, not only help you to find the right answer, but the keywords help you eliminate bad answers. They're very, very important. All right? It's 9:43. We have time for another scenario. So let's go on this one. Miss Melissa, would you mind reading it, please?
Sure. All right, here are your answers. A is 69620 with modifier LT. B is 69635 with modifier LT. C is 69676 with modifier LT. And D is 69610 modifier LT. An ENT performs a patch repair on the left eardrum of a 10-year-old patient. What CPT code is reported? And I've got you set for 2.5 minutes, starting now. All right, that's time. Man, I can't keep up in the chat. You guys are so fast.
Okay. Got a couple people saying they're not sure. And we have sort of a mix of answers, so I'm going to start walking through this one. Just so you know, coders, the answer is D. While you scratch your head, I'll start walking through this. All right? Code words, keywords, excuse me, patch repair, left eardrum, 10-year-old. And of course, this one's messed up too. Sorry, coders. Just a second. I'm gonna take this back. Let me see if I can fix this real quickly. If you have questions that have come up along our way, Miss Melissa, if you can answer them, I'm going to quick fix this slide.
I would be happy to. Now's your chance, coders. You get a few minutes just to ask all your questions. I'm looking. No questions, huh? Well, I saw somebody
about the class. They could be about other stuff.
Yeah, I was going to say I saw somebody say yay to keywords, and yes, ma'am, keywords are essential. They are really what I'm sure saved me tons of time on the exam. So it is very important that you practice putting your keywords in the chat for us. That just gets you practice on the exam. You can take highlighters in. I took, there's some highlighters that are clicky highlighters so that you don't have to take the cap off and put them back on. And so that's the highlighters that I took so I could use different colors. Just a little tip and trick for you. All right, somebody's asking about what do you think is going to win the Super Bowl. Girl, I haven't really been paying attention. I've been so busy. I'm more of a basketball fan. I can't wait for March Madness. And Miss Cheryl, I think we will do one more. Just as soon as Miss Marie gets that slide ready, we will finish that, and we probably will have enough time for another one.
I think we will. Remind me when we get closer to March Madness, you guys, I used to manage a Big Ten basketball arena. So that's my time of year.
Awesome.
Okay, I did not get this quite all fixed, but let's go through this so we have time for another one. Keywords, patch repair, left eardrum, 10-year-old patient. Okay? First thing we're going to look at, as you can see since it's already lined out, is 69676, tympanic neurectomy. At any point in time, did we see anything about a neurectomy in this scenario? Does it match any of our keywords? No. So it got kicked to the curb. Okay, 69636, tympanoplasty with antrotomy or mastoidotomy, including blah, blah, blah. Do we have any of those words in this scenario? Do you see antrotomy, mastoidotomy, canoplasty, adicotomy, blah, blah? No? What does that mean? You know what? I'm guessing my slides are not showing. Can you guys see? Okay.
It's up now.
Okay. Yep. 69635, tympanoplasty, antrotomy, mastoidotomy. Do we have any of those words in this scenario? No. So you know what? Bye-bye, 69635. All right, now Laryngoplasty. This says surgery confined to drumhead and donor area. That one's sort of interesting, but we're going to look at 69610. Tympanic membrane repair with or without site preparation of perforation for closure, with or without patch. Patch. That matches our keywords, doesn't it? That's a pretty good clue. Patch repair. It's the only one that echoes our keywords. And so we're taking answer D. All right, any questions? Got it? Okay. All right. I'm going to move on. Ms. Josie, if you could read this for me, please.
Sure, and we're going to start with the answers. A is 67916, modifier 50. B, 67916, E4, and 67914, E2. C, 67914, modifier 50. D, 67923, E4, 67921, E2. A 65-year-old patient presents with an ectropion of the right lower eyelid. Repair with tarsal wedge excision is performed for correction. Attention was then directed to the left eye. The patient also had an ectropion of the left lower eyelid, which is repaired by suture repair. What CPT code or codes are reported? And we're going to begin with the 2 minutes, and you may begin now. Okay, coders, you're doing really good on that one. We need to get a few more answers in, but mostly everybody's coming up with B's, a few C's, and one A.
Okay. All right, coders, what's the first thing you notice about these 4 answers? What's up with those modifiers? Did the same thing happen to both eyes? Right. So in all likelihood, A and C are not going to be on the good list. We're good coders though, so we're going to check. All right? And answer is B. Keyword, 65-year-old patient, ectropion, right lower eyelid, repair with tarsal wedge excision, left eye, ectropion of the left lower lid, repaired by suture repair. So let's look and see what these codes are doing for us. First of all, do you guys know the difference? Do you know what entropion and ectropion is? The way I remember it is entropion, it curls in, E-N, in. That's how I remember which one's which. Ectropion, the eyelid kind of curls out away from the eyeball. I'll wait a second in case anybody wants to take a screenshot of this because I thought it was a pretty good illustration. And I'll move on in 5, 4, 3, 2, 1. Okay. We don't have a whole lot of codes to look at here, but D, 67923 and 67921, they're kind of the odd men out, so we'll look at them first. We're coding for ectropions. 67921 and 23 are for repair of entropion. So we're going to eliminate answer D. 67914 is the parent code, repair of ectropion for that family. First one's by suture. And then 67916 is repair of ectropion by excision tarsal wedge. Those are looking pretty good. They match our keywords, don't they? So, do we have the right eyeball? The right lower eyelid was repaired with tarsal wedge resection, 67916. We look at our modifiers here. Right lower eyelid, E4, 67916, B matches. We can eliminate the other two answers because, again, modifier 50 is a bilateral procedure. That's not what happened here. We had different procedures on both eyes. So we're going to eliminate A and C. And once again, verifying 67916 is the excision of tarsal wedge, and that was performed on the right lower eyelid. 67914, repair of ectropion by suture, that was done on the left lower eyelid. So even the modifiers are correct. Does that make sense to everybody? Oh, I'm behind myself. Here's some more pretty. Okay, everybody got it? Let me know if you have questions. Okay, how many of you are planning? It's 10 o'clock right now. How many of you are planning on being at Wednesday's class? How many of you have already reviewed all of the radiology and anesthesia area slides? Not yet, but you will. Good, good, good. Before I forget, because I know a couple people take screenshots. Here is the corrected slide. There are some changes for 2019. So you're going to probably want to check the 2019 lectures. There's no changes for anesthesia, but there are a few changes in radiology. Okay, if anybody wants a screenshot of that, go ahead and take it. You guys have been fabulous tonight. I want to thank the whole team. Miss Melissa and Miss Josie kept you occupied while I was scrambling behind the curtain. All of you did really, really well tonight. What time is the Chun party? The Chun party isn't really a time. Every morning I'll go in and I'll post the pages for that day. Okay?
And then coders, your job is to take pictures of your books and post it so we can see and everybody else can see what you're chunning, how you're doing your pages.
That's true. That is the most important thing because you can all learn from each other. People have great ideas. There's no perfectly right or wrong way to chun. The important thing is that it's clear and that it makes you able to see the correct information quickly. Doesn't want to be too busy, doesn't want to be too undocumented, all right? I think you guys did a great job tonight. I'm not sure, there they go. I'm applauding you up here in Arctic, Michigan. Nobody's got any questions. I'm going to say goodnight. You were a great class and I appreciate it. Thanks again, Miss Melissa. Thanks, Miss Josie. You guys were fabulous and I will talk to you on Wednesday, if not before.